The number of coronavirus cases continues to grow in China and around the world, but there's still a lot of confusion about the deadly virus.
I'm here at LAX talking with international passengers arriving at Tom Bradley Airport about how they're staying safe during this COVID-19 scare.
I'm Brogan Kroener.
I'm Keith Leach. See It Live starts now. The coronavirus epidemic that started in Wuhan, China, has caused people around the world to take precautions.
To get a better understanding of the virus and who is most at risk, I spoke with a doctor from the World Health Organization.
It's a big family, and it's been in humans for a long time, and usually in the past just caused nothing much more than a cold. But we've seen recently that some of these are now jumping from animals to humans. And when any virus jumps from animals to humans, we've seen the same thing with Ebola. It can cause quite severe disease because it's trying to sort itself out and work out how it can live or not live or what it can do inside the host. This one seems to not cause. It causes severe disease in a relatively small percentage of people and does cause death in those people. But the vast majority of people that have a relatively mild disease, and interestingly, it's learned very quickly how to spread itself quite effectively.
Now, what is the World Health Organization's role during a health crisis such as this one?
So we're doing various things. One of them, of course, is identifying how many cases there are, informing the world, helping China with reporting the case definitions, helping with advice on what to do to prevent the spread. That's infection prevention and control. So that's talking to them about different strategies for hygiene, for preventing the disease itself, bringing together the scientists to identify this virus.
How does this coronavirus compare to past health crises?
It was identified very, very quickly. We were first notified of it on the 31st of December, and within a few weeks, we knew that it was a coronavirus. You know, the various scientists had identified what it was doing. A test for it was available within the middle of January. This is extraordinary speed. When we saw the equivalent with SARS back in 2003, it took much longer. It took months to identify that this was also a coronavirus, and it took longer to find a test. So the speed with which this is happening is down to all the scientists working together, all the scientists from the different countries sharing data.
Now, how do we get a contagious virus like this to stop spreading?
It will end when it can't transmit further. It's lost its opportunities to transmit. So that's what containment's all about. If we are immaculate with our hygiene, it's got nowhere to go.
Coronavirus, officially renamed COVID-19, has spiked in China's Hubei province. There have been more than 1,300 deaths and over 60,000 cases confirmed. The Center for Disease Control has confirmed at least 14,000 cases of coronavirus in the U.S. 8 cases are in California, 2 in Illinois, and 1 case reported in Arizona, Massachusetts, Wisconsin, and Washington State.
Annenberg media reporter Chace Beech is live at the Tom Bradley International Terminal at LAX. Chace, do travelers seem concerned?
Thanks, Keith. I'm here at Tom Bradley International Airport, where passengers are arriving to LA from all over the world. According to the Public Health Department here in Los Angeles, anyone arriving from mainland China in the next few days should still stay pretty much in isolation for about 14 days or so. Some people have even been assigned public health nurses. Earlier today, I did get to chat with a couple people arriving from all over the world here to Tom Bradley to hear about how they've stayed safe and what precautions they've taken during their flights back to LA.
I just didn't want to risk getting sick, and with the coronavirus going around, I was just being very, very cautious.
Actually, I know that I have to keep my hands washing with warm water and do not touch my face, eyes, and mouth.
We need to be cautious about the disease because it's not that serious in U.S. right now, but since I'm from Taiwan, it's close to China, right?
So despite the COVID-19 scare and the news that's been coming out, the atmosphere here at Tom Bradley at LAX is honestly pretty relaxed. Passengers are really just happy to be off the plane and get home somewhere warm. Back to you in the studio, Keith.
Thanks, Chace. USC students, staff, and faculty received an email this morning about travel during spring break in light of coronavirus. The email from the VP of Student Affairs said, quote, "Students are encouraged to closely evaluate non-essential travel throughout Asia during the spring semester. Students who are Chinese nationals are advised to contact the Office of International Services to discuss plans in advance of any international travel. For some students, the virus has impacted spring break plans."
Actually, in America, I feel that's safe, but in China, actually, it's very severe. You cannot, go out the city. You must. All the boundaries has been locked. So.
Oh no, spring break is too short. It's only like 1 week. Normally, I think Chinese students want just to go back to home during spring break. Most of us will go back during winter break.
The Office of Student Affairs encourages students who are worried or concerned for family at home to reach out to counseling and mental health services for support.
The coronavirus outbreak has caused an increase in prejudice towards Asian Americans and Pacific Islanders. Community leaders this morning pledged to support victims of these physical and verbal assaults. In downtown LA, government and health officials urge people to resist anti-Asian stereotypes. LA County Supervisor Hilda Solis emphasized that prejudice towards ethnic groups cannot be tolerated.
Point here is that we're trying to say, if you see something like that, report it, speak up, and we want to put a stop to it because it's not fair. We know that many of our Asian Pacific Islander businesses and restaurants are being impacted right now. People aren't going and shopping. Even amongst the community, there's fear because they don't want to be singled out. And we heard of the instance of a young child being beat up because young children pointed out and said, oh, he has the virus, he's Chinese. They beat up this student, he had to go to the hospital. We have to say no, and we want parents to speak out. And this is another way of targeting that hype and creating that anxiousness and indifference. And we are better than that.
Some doctors worry that all the hype about the coronavirus is taking attention away from the seasonal flu, especially considering low vaccination rates this year.
I'm not worried. I think I'm much more worried about seasonal influenza virus. I think that this has to be put into context. 61,000 people died in the U.S. in 2017, 2018 from flu-related illness. We've a handful of cases in the U.S. We've had no deaths. So I think it's important to put that into perspective. I'm much more concerned about seasonal influenza. I'm much more concerned about the fact that we don't have high vaccination rates.
Dr. Butler Wu suggests people focus on making sure they have their flu shots and practice good hand hygiene.
Some businesses in Chinatown have also been struggling as the coronavirus outbreak worsens. Store owners and managers are seeing a decline in visitors during Chinese New Year. This is typically their busiest time of the year.
We lose quite a bit of business, and especially the New Year parade on February 1st. We used to have about 100,000 people to come to look at the parade. Now, I think we have we lost about 60%.
It's the coronavirus effect, so our business is really slow since last week.
Despite fears of the virus, people are still showing up.
Definitely did not affect my decision to come here. I, obviously thought about it, and I, thought about whether or not people were going to be here or not. But it is upsetting to see that it's such a beautiful day and it's kind of, not really many people here.
An Orange County man is the latest to be affected by the virus, but a spokesperson for the Orange County Healthcare Agency says residents don't need to worry. She said, quote, "We have no evidence of person-to-person transmission in Orange County, so the risk to the public is still low in Orange County, but it's not expected for us to identify another case."
With anxiety growing around the coronavirus on campus, multiple students have started wearing masks as a preventative measure. But doctors say masks might not be the answer, and preventative measures are actually a lot simpler.
The evidence seems to be that this is a virus that you transmit through droplets, saliva. So if you cough or you sneeze, you will project some of the virus only over a couple of feet. Just being aware that transmission tends to be hand to face, and that's why we say wash your hands or use hand sanitizers. If you're just mindful about that, if you You know, rather than picking up a cookie to eat with your hands, maybe use a napkin to pick it up so that you just get in the habit of reducing transmission of anything.
Here are some common sense tips from Dr. Cannon to help you stay healthy. Keep your hands away from your face, use hand sanitizer regularly, and cough or sneeze into your arm. Now, Keith, it really seems like it just boils down to washing your hands.
It sure does, and I keep a hand sanitizer in my backpack at all times, so I can use it anytime I need to eat, anytime I'm going to the restroom. It's great.
Good for you. You're doing your part. Now, I really quickly want to clarify that I said earlier there are 14,000 cases in the U.S. It's just 14. Big difference there, but I want to clarify that for our viewers. But anyways, thank you so much for watching See It Live. From everyone at Annenberg Media, I'm Brogan Kroener.
And I'm Keith Leach. You can watch us on the web at uscannenbergmedia.com. And for even more USC news, download Annenberg Media's new app, Annie, from the App Store or Google Play. Good night.